begin with offering my pranams to His Holiness Jagadguru Shri Shivratri Rajendra Mahaswamiji and seek divine blessings from His Holiness Jagadguru Shri Shivratri Deshikendra Mahaswamiji, whose pioneering work, whose vision, whose foresight has made the JSS Academy of Higher Education and Research the global leader it is today in all areas of sciences, health sciences, engineering, and many, many other specialties. Your Vice Chancellor, Dr. Basavana Gaudappa, was telling me this morning the range of educational institutions that are there, and the kind of service that is being offered, the kind of quality of education, and a very holistic education. So I do believe that each one of you is very fortunate to be part of this institution, and it is my great honor and privilege that you have considered me for this oration. I would like to, of course, thank the Vice Chancellor, Dr. Basavana Gaudappa, and Dr. Ravi Kumar, the Chairperson of the Academic Society, all the dignitaries who were there on the dais, off the dais. Thank you for coming, spending your precious time to listen to me. With all the things that I was hearing about Pioneer and this and that, I was like, no pressure here, I have to perform. And I hope in the next 40 minutes or so, I can discuss some aspects of maternal mental health. It's a wide canvas. There are many areas of research, but I have chosen some specific areas following some extensive discussion with Dr. Kishore, who, as you all know, is a real tour de force in the area of mental health under the mentorship of Professor Satyanarayan Rao. And as a young person, as a young professional, he has really shown so much promise, and I'm delighted that we are working closely together on many aspects, and maternal mental health being one of them. So I'm going to talk today about matrescence and beyond, and take you through the journey of what it means to be a mother in today's world, and also why it is so important to pay attention to maternal mental health for not just the mother but the generations to come. So I bring greetings from NIMHANS, which is my alma mater. I have trained there, and except for a stint working in mother baby units in the UK, I have come back to set up services, to enhance services in our country. This is my wonderful research and clinical team, and today I'm here mainly because of them and many others who have worked with me. So I have a very large group of people working with me, and these are all young people who are researchers, who are clinicians, who are students, who are to the growth of this science. And I would acknowledge them. I would also like to acknowledge all my funders, which includes the Wellcome Trust, but it also includes the GCRP, the NIHR, the ICMR, MRC, Universities of Liverpool, King's College London, and the Manchester Metropolitan University, because I'm doing a lot of work with each one of them. So a lot of the work that I may talk about is being done in collaboration with these groups. So this is the outline of my talk. I'm going to talk about what is matrescence, what happens when a mother has emotional stress, what is prenatal stress, the various types of prenatal and postnatal stress, what is the downstream effect on pregnancy, the infant and the child of the stress that the mother goes through, and some findings from our cohort study, which is called the Bangalore Child Health and Development Cohort Study. So let's understand the concept of matrescence. In fact, if you type matrescence in your Word document, you will get a red underline because it is not yet recognized by a dictionary, which is very sad because matrescence is a stage like adolescence. So now what people are saying and what science is showing is that you have rapid and multidimensional change in adolescence, you have similar multidimensional and rapid changes when a woman becomes a mother. Now, and it has become a framework for understanding maternal experiences across the perinatal period. Just to give you an example, adolescence you have puberty, and matrescence you have pregnancy and postpartum. In adolescence you have identity formation, new identity is formed, and that's why it's such a vulnerable period for identity. Similarly, matrescence, those of you who are mothers know that once you're a mother, your identity changes completely. Then from a woman, you just become a mother. Everything centers around your child till that child becomes God knows how old. Okay, it never stops. So it's a complete change in identity. You stop thinking about yourself, and this little being, vulnerable that is, becomes your whole life and your whole world. So everything completely changes. There is a lot of brain remodeling we know in adolescence. So we know that the brain is has the most plasticity in adolescence. Lot of pruning of neurons is happening, and that is why it is such a vulnerable time for many psychiatric problems, because it's a time when the brain is going through a whole range of remodeling. Now, what is science is showing is that probably the only other time in a person's life, in a woman's life, that this much amount of remodeling happens is in the maternal brain, and I'll talk about it a little later. So, huge plasticity is happening in the maternal brain. Neurons are moving, some parts of the brain are shrinking, some parts of the brain are expanding, basically to make sure that she can focus on mothering. So we are not even aware of the changes that our brain is going through when we are becoming a mother. So that is the kind of plasticity that is happening, and that's why it requires a separate subject altogether. You'll be interested to also know that fathers also go through brain changes. So there are parts of the, not as much as mothers, but they also go through changes. So there are parts of the brain which are involved with empathy, which increase, which are involved with paying attention to small signals of the infant, which increase. So both parents' brains are going through much more changes. However, the changes are enormous in women. Again, another reason why, like adolescence, the mother's brain is also very vulnerable to developing mental health problems because of the kind of changes that are happening. Of course, new social roles are happening in adolescence, also in matrescence, and there is increased emotional sensitivity. In adolescence, you know that adolescents become very, very sensitive to anything that you say, but in matrescence, there is more increased emotional responsiveness. The mother, you can see that a woman is becoming much more responsive to the environment around her. So all of these reasons indicate that actually matrescence is a word that needs to be in the dictionary and that needs recognition. This was a motherhood index survey which was done recently across 6 countries, and 93% of mothers report a meaningful change, identity change after becoming a mother. 50% felt like they were a completely different person, and only 2% said nothing has changed. So you can imagine the amount of changes that a woman feels within her when she's going through pregnancy and the postpartum. There are huge psychological transitions. Many of you in the audience who have been mothers, who have seen mothers, know that the mother becomes very attuned to infant cues. There is a complete reorganization of priorities. There is development of maternal attachment and bonding. Now this maternal attachment that is very crucial to all subsequent growth of this baby is something which is very important. Attachment is what the infant feels to the mother. Bonding is what the mother feels to the infant. The bond between mother and infant, which is so unique, which has been, artists have drawn it, poets have written about it. It's a very unique bond which develops. There is increased emotional and cognitive adaptation, and of course there is a lot of uncertainty. They say that pregnancy and the postpartum period and childbirth are probably the most vulnerable and uncertain periods in a woman's life. And that is true, despite the fact that we've had so many advances in medicine, in gynecology, in obstetrics. it's still a very vulnerable period. Even in many advanced countries, it is still a vulnerable period. So it increases the level of uncertainty. The more the uncertainty, the more the stress, the more the anxiety, because you can never predict that something solid is going to happen. However, we must also remember that it is all not negative. There's huge psychological growth which happens through motherhood, and women talk about really becoming completely evolving, becoming another person when they become a mother. There are social transition. There's complete changing dynamics with partner relationships. So the husband who was probably the center of the woman's life till now gets replaced, and it becomes the baby, and it has repercussions in many, many ways. But I think that is another important aspect that we must remember. There is, of course, transition. There is balancing motherhood with other life roles. There's a lot of cultural expectations of what an ideal mother should be. So if there is a mother who is not able to feel the way she should feel for her baby, there is a lot of stigma in even accepting and talking about that. And adaptation to workplace and societal demands. We still, in many countries, maternity leave is still a luxury. We are very lucky in our country that we have maternity leave, but we still have 2 weeks of paternity leave, which the father will take and probably go do something else rather than being with the baby. So I think we really need to, make sure, and over the course of my talk, I'll discuss why it's important for everyone to be involved in care. I want to point a very important area which is now becoming the center of research in mental health in pregnancy in the postpartum, and that is the change in sleep and circadian rhythms. So we know that there is increased sleep needs in the first trimester. There can be frequent nocturnal awakening. There's a lot of physical discomfort, hormonal, and completely altered circadian rhythms. So now the fact that sleep becomes so disrupted in pregnancy and much more in the postpartum is coming through as an important factor that determines mental health for mothers. In fact, what we are doing now is for mothers who have had some past history of a mental health problem, not necessarily a severe mental illness, but it could be anxiety, depression. We are actually doing sleep education in the pregnancy itself. And sleep education importantly involves the partner, because frequent disruption of sleep is actually a risk factor for subsequent mental health problems. So we actually discuss with the partner who will be there to look after this baby after the childbirth. Because what happens is we focus so much on having a baby, we forget all the things that happen after the baby is born. So nobody really plans about how to manage sleep. So the current recommendation for adequate mental health for mothers is basically 4 hours of uninterrupted sleep, first sleep, 1 break, and then 2 hours of uninterrupted sleep. And this is absolutely essential for mothers. It never happens because a mother gets up, baby has to be fed, then the baby has to be cleaned, and by the time all that is done, the baby is wide awake and the mother has to sit with the baby, and 4 hours of her sleep is gone. So there's a lot of sleep disruption which partners, families actually have to acknowledge and participate in. It is not just the mother's problem, and I think this is something that is being recognized world over and is a strong risk factor. And like I said, sleep disruption in the postpartum period, which also leads to cognitive and attentional difficulties, and there is often a mismatch between infant and maternal rhythms of sleep, and that's something that is now being researched quite a bit. How can you regulate adequate sleep for both mother and baby so that mother's mental health is looked after? In fact, they say that 70% of mothers get fewer than 5 hours of unbroken sleep per night, a level of deprivation that clinically impairs decision making, emotional regulation, and cognitive function. It's a health crisis so normalized that it doesn't register as one. So there are many things about motherhood which we have normalized, which we have assumed that it should happen this way without realizing the impact it is having on a mother's mental health. So there's a lot of research now going on what is called the maternal brain or mommy brain. Mothers will talk about brain fog or mommy fog, that can happen when the baby is born, and it is real. The signs of forgetting everything but the baby. So what happens is the way the brain is structuring itself, that we are not interested in thinking about anything else but the baby. So there's a lot of forgetfulness and poor concentration related to everything else but what is most important. And this is evolutionary. This is how the maternal brain has evolved over the years, trying to pay attention. And there's a wonderful study which was published in the journal Nature 2 years back, which took the world by storm. Till then, people were not very sure about the brain changes that are happening in pregnancy and the postpartum. And in this particular study, what the scientist, who was also the author of the paper, what they did was, she was going through IVF. So she had 3 fMRIs before the pregnancy, before the implantation. Then she had 15 MRIs through the pregnancy and another few after the pregnancy, so till the first year postpartum. So all in all, this woman voluntarily, pre-pregnancy, pregnancy, post-pregnancy, had 26 fMRI findings and PET scans to see how the brain changes. And what we found was that the grey matter decreases, but the white matter increases, the connections increase. Parts of the brain which are important for empathy enlarged. And that is where the focus was going. And that is why the women were not able to concentrate very well, because parts of the brain which were important for bringing the baby into the world and taking care of the baby were what was increased. And this normalized after 6 months of postpartum period. So these are things which now, because of science, we are able to learn many things about the maternal brain and why it is vulnerable and why we have to look after it much more carefully. So this is what is the incredible postpartum brain, and basically reduction in grey matter, in reward and social cognition processing areas, and increase in areas which deal with motivation, empathy, emotion regulation. Emotion regulation means managing your emotions even when things go wrong, and sensory information processing areas, particularly tactile stimulation of all senses by infant cues. So mothers are very sensitive. So mothers might have told you that, when they're sitting in somewhere, they can hear their babies cry. And they can distinguish which is their baby amongst all babies. And the pediatricians here who are working in NICU will tell me that I'm right, that mothers can actually identify which baby is crying and it's their baby. So it's something that is very, it's the brain which is doing it, not anything else. So I think that is the reason why it's important to pay attention. So changes in the maternal brain, like I said, there is increased activation, networks change of the prefrontal cortex and the amygdala, increased neural sensitivity to infant, and activation in the empathy circuit. So in the brain there are lots of circuits. So one is of course the gross brain, but there are a lot of networks which are there. And the networks which are more focusing on care, empathy, affection, attention are what are increasing in the brain. So having seen that these are the challenges a woman is facing when she is pregnant, and the fact that her brain is quite sensitive at this point to many things. It's a great brain at that point. It's doing all the right things. But because of the amount of plasticity that is happening, the amount of changes that is happening, it is also more vulnerable, like in adolescence. So this is something that in the last about 10-15 years has become a big science about early life experiences leaving biological footprints that last decades. So what our mother thinks, feels when we are in her womb and in the first few months of postpartum determines many of our things, many parts of our life, lifelong. If you want to change generational health, both physical and mental, paying attention to the first 1001 days of a baby's life with the important life in the womb becomes very important. And maternal mental health is like one of the most important aspects of it. So this was a Time magazine which talked about how the first 9 months shape the rest of your life. Most of you must be knowing Professor Barker, who basically talked about the developmental origins of health and disease. And this work in the UK, which spanned many years, found, interestingly, that people in their 40s who had hypertension and diabetes, he traced back their records and found that the mothers had nutritional deficiency. And that was what determined what, between people who didn't have these problems and had the problems, it was, the difference was nutritional deficiency in the mother. Now this is being extrapolated also to what happens to mothers' mental health and what happens downstream. So many of you must be knowing the concept of fetal programming. So it's basically environment in the fetus during different critical periods for specific outcomes can alter the development of the fetus with permanent effect of the child. And this is a field which is growing a lot and is one of the basis of why we are paying so much attention to maternal mental health in many countries. So what are the types of different, when we say prenatal stress, what do we mean by that? We mean life events. So if somebody's had a bereavement, somebody has lost someone in the pregnancy period, that is a big life event. So many mothers come to us and say they lost their parent, they lost a best friend. During COVID, there were many losses which were happening. So that is a life event which actually increases the stress level enormously. Domestic violence, I'll show you some data. We would think that in pregnancy there is no domestic violence, women are looked after very well, but that's not necessarily the case. Rates of domestic violence are pretty high, and I'm going to show you some data. There can be pregnancy-specific anxiety. This is a unique condition where the mother is mainly worried not about anything else, but about her own health, her baby, the pain that she may feel during labor. So it's all about the baby and herself. There can be depression, there can be suicidal behaviors, bereavement I mentioned, and what we call post-traumatic stress disorder. So if a mother has had a very difficult childbirth in the previous pregnancy, or if she's had a neonatal loss or repeated miscarriages, then this pregnancy can be a very difficult time for her, because especially around the time that the miscarriage happens, she will start getting flashbacks of what happened earlier. Around the time that the baby is going to be born, she may again relive the trauma that she went through. If she had a very difficult childbirth or an unsupported childbirth, disrespectful childbirth, she can remember these things. So all of these things can cause stress. I want to give you one example of studies which were done around stress. So what happened, we all know what happened in 9/11 when the Twin Towers came down. So what the scientists did, this was an NIH study, which basically looked at the areas around the Twin Towers. People who were near, people who were further, people who were further. And they traced all the pregnant women in that period. So pregnant women who were immediately within 5 kilometers, who were 10 kilometers, who were away. And they compared developmental outcomes of the babies of each of these mothers, because the stress levels are higher in people who are closest to the Twin Tower blast that happened. And lo and behold, what they found was actually both behavioral and developmental problems were much higher in the women who were closest to the 9/11, to the Twin Towers. And this was a very famous study called the 9/11 study, because it gave an opportunity for us to actually think, when there is a huge stress which can happen in a mother's life when she's pregnant, what can be the downstream impact, controlling for everything else, that stress like this can actually impact developmental outcomes. This was another very famous study which looks at prenatal stress, which is called the Project Ice Storm. Project Ice Storm, this was a Quebec, which is a state in Canada, had a big ice storm. People were cut off for about 45 days from electricity, water, heating, everything. It was a very stressful time. They followed up mothers who were pregnant at that time and looked at what happened to those babies. And what was interestingly found, that some mothers coped with the situation very well. They had very good preconception coping skills. That's how they were. For some mothers, it was very devastating. It also depended on resources. Some mothers had resources. They had money, they had food. Some mothers didn't. All of these seem to increase the level of stress and there was an impact on developmental and behavioral outcomes. So that was when studies started thinking, okay, what is it that is changing? What is happening? So mothers feeling stress, how is it going to the fetus? Let's look at the science of it. So that is when we started discussing how maternal stress reaches the fetus, because we all will think, how does maternal stress reach the fetus? Cortisol, of course, is the biggest culprit. So now we know that cortisol, basically what happens is when the cortisol cannot cross the placenta, because there is an enzyme called 11-beta-HSD2 which metabolizes cortisol. So cortisol, if it reaches the placenta, it has an impact on the baby's brain, on the hypothalamo-pituitary axis. What happens when we have very, very high levels of stress is that cortisol levels increase tremendously in the mother. There is down-regulation of the enzyme. As a result, the dehydrogenase enzyme is down-regulated. As a result, the cortisol reaches the fetal brain, particularly the HPA axis, dysregulating the HPA axis, which can lead to many outcomes, including low birth weight, HPA axis activation, and altered neurodevelopment. This is the the most researched mechanism which has been done. There is a sweet which you get in Australia, Canada, which is called licorice. Some of you may have heard about it. What they found was women who were eating licorice were actually having babies with developmental problems, not gross development problems, but ADHD, neurobehavioral problems. And when they went back, they found that actually what licorice does is that it inhibits the 11-beta-HSD2. And that is how they realized that 11-beta-HSD2 is a very, very important enzyme, and high levels of stress can actually impact it and lead to downstream effects. However, now there's a lot of research in this field, because it's a very interesting finding that has happened, and there are several ways in which maternal stress, psychosocial stress can actually impact the baby. It can impact them through cytokines, so more inflammatory cytokines which cross the placenta, changes in tryptophan and serotonin, which we know affects the brain. Oxidation can happen, changes in catecholamines, and changes in microbiota. So many researchers are now trying to look at how all of these things can impact the fetal brain and the fetal body. So these are some of the things which are now coming up as newer areas of research. So your Vice Chancellor mentioned the Wellcome Foundation grant that we have just now got. What we are doing in the Wellcome Foundation grant is we are following up mothers from the second trimester of pregnancy till first year after childbirth. We are assessing anxiety, stress, a whole range of conditions. We are also taking saliva samples for cytokines, for cortisol at every 2 weeks till childbirth, and then at 6 weeks and 6 months, trying to see whether there is changes based on the stress that we are assessing. The way we are assessing stress is we use something called very advanced methods. It's called ecological momentary assessment. I mean, some of you may be aware of it. So basically, we take the saliva, at the same time we assess for all levels of stress. The mother actually reports it. We check their heart rate variability. So we are getting measures of stress in various ways and trying to see how the stress seems to be impacting immune parameters, seems to be impacting cortisol, to give us a better idea of what is really happening. I talked a little bit about circadian rhythms earlier, and I'll talk about it again. There is an impact of maternal circadian rhythms on fetal heart rate and fetal sleep. So that is the reason why now, in today's world, where many mothers may be using their smartphones late into the night and watching things and not sleeping adequately, it is going to impact the fetus also, because the mother's circadian rhythm will also impact the fetal circadian rhythm, and that is again going to cause stress to the fetus. So I think these are things that we really need to be paying attention to, because these are newer problems that we are facing now. Because a lot of mothers, when the baby is not sleeping or something, can start watching. We know that the light is activating, she may not sleep further, and baby is also going to be, the fetus is also going to be awake because the mother is not resting. So these are things that more research is actually needed. Maternal stress can impact the autonomic nervous system. So one is through cortisol, but also through autonomic nervous system, and any of these can also lead to different outcomes. What are the types of postnatal stress? So we looked at all the prenatal stress till now. Postnatal stress can be a poor birthing experience, parenting if she's a single mother, she doesn't have help, problems with breastfeeding, latching, very common. If the baby's health is poor, so mothers whose babies are in NICU are at very high risk for maternal mental health problems, and they are a population who need that extra support. And it's very important for us to be able to provide services for them. We discussed sleep deprivation and domestic violence. So does postnatal stress have an impact in the presence of prenatal stress? Yes. So if a mother who's gone through a lot of prenatal stress also has postnatal stress, then that is going to actually create epigenetic changes and changes in all the other aspects that I mentioned, leading to more problems. So the postnatal environment is as important as the prenatal environment. What is the role of protective factors? We talked so much about sort of vulnerability and risk factors. Protective factors like social support, resilience in the mother, her own ability to be sensitive are all areas which are protective. And that is where our culture in that sense is very good, because we are able to provide that kind of support and protection to our mothers. Not in all cases, but in many cases, majority of the cases, mothers get that support. But they also are stressed out because of so many reasons. But I also want to emphasize here that preconception mental health, the health of a girl, a woman, before she becomes pregnant is as important. It's not that we can start paying attention to the mother only when she becomes pregnant. And that is why now UNICEF has started a big campaign on preconception health of the mother, which includes nutrition, which includes mental health. And I think this includes body weight and many other aspects. We're trying to see how we can improve preconception health so that mothers have better outcomes. Those of you who are interested in genetics, we all know now that prenatal stress actually can impact DNA methylation, which causes epigenetic changes. And DNA methylation can actually change many things in the infant and cause a lot of downstream effects. So now evidence that there is something called epigenetic memory, which is a proposed biological mechanism in mediating many of the changes that we see. And that is something to watch out for. I'll just show you some examples without making it too heavy. So if you can see the various genes that I've talked about. So depending on the type of stress, the methylation changes in different types of genes. So some of these genes are important for attention. Some of these genes are important for emotional regulation in the baby. Some of these genes are important for behavior. And with prenatal stress, there are methylation changes which are happening in many of these genes, including intimate partner violence, domestic violence can actually cause methylation, and that is something which is worrying. Very important studies which relate to what is called intergenerational transmission of trauma. So not just mothers, even grandmothers' trauma can be intergenerationally transmitted to the fetus. So it's a lot of studies, particularly in places like Rwanda, where multiple generations have gone through trauma. Studies have shown that the grandmother has gone through trauma. Whatever methylation happened is actually transmitted through the daughter to the next generation. So very important to look after women's mental health if we want to look after the next generations also. So just to kind of summarize this to you, different types of stress may have different type of outcomes. Some may cause attentional problems, some may cause behavior problems, some may cause developmental problems. Different types of stress may have different outcomes. So excessive stress in the first trimester has been linked to conditions like autism and schizophrenia. Second trimester it's linked more to low birth weight. Third trimester is linked more to ADHD. And much more research is going on to try and see the critical points for different kinds of developmental conditions. And like I said, the postnatal period may have a great influence as well, including protective factors. So it's not all bad. there is a lot of things that you can actually do to enhance and make things better for the baby. Finally, I just want to go through what is called the Bangalore Child Health and Development Study. This is a cohort study which we are doing in South Bangalore, which basically followed up 909 mothers. This is a study which has been jointly funded. First wave was funded by ICMR and MRC, and subsequently we have got funding from MRC. We have followed up 909 mothers from their first trimester of pregnancy, and now the children are 10 years old. So it gives us such a wonderful opportunity to look at what is happening through various points. So we have done assessments for mental health and cortisol, immune markers in the first, second and third trimester of pregnancy. Then we had some funding problems, so you can see sample went down. Then again during COVID also we followed them up. So we've done 6 weeks, 6 months, 1 year, 2 year, 5 years, 7 years. And now the kids are 9 years old and we are trying for funding to follow them up through adolescence, which is a very, very important time. But what a cohort study like this will tell us is what are the things which happen in pregnancy and at what point downstream effects happen on the child. So what have we done in the Bangalore Child Health and Development Studies? This is 3 waves, including the pandemic where we did phone follow-ups. So we did repeated measurement of various mental health problems, including family violence, domestic violence. We are doing detailed neurodevelopmental assessments of the child and anthropometry. What we call dyadic measurements. That means we look at how the mother and child are interacting with each other. And we do videos of this. So we have a lab which we call the mother-baby lab, which is in the community, because these families are community samples. They will not come into a hospital. So we have a community lab where we do these assessments, we video them, their interactions to try and see what is the quality of interactions. Does that make a difference? We also invite grandmothers and fathers into the video to see if a mother is depressed, if a grandmother is around, does it change outcomes? If a good father is there, does it change outcomes? So these are things which will actually give us a lot of potential for intervention. We do maternal cortisol and then we take child saliva sample for gene and environment interactions and for methylation at 1, 2, 5 and 7 years. And it's very interesting because these kids actually come into the lab and we tell them they're not supposed to brush. So they're very happy because they don't have to brush. And they come to the lab, we take their sample, we give them a toothbrush and toothpaste, and then we give them breakfast and then do all the assessments. So they literally spend about a day with us at these points. And it's very interesting because we've seen these children as babies and now we are seeing them as 7-year-old, and we can actually see the trajectory and what all factors are influencing this, including the prenatal stress and the immediate postnatal period. We also look at factors like gender discrimination and to study whether that makes a difference to outcomes, and also studying grandparents and fathers. So we are also looking at fathers' mental health and grandparents' mental health, particularly the grandmother, because in many families, the grandmother is spending more time with the baby than the mother. So does that help? I mean, if a grandmother is also depressed, will it make a difference to the baby? So all of these things are actually being studied in great detail because these are unique cultural things. These are things which are not present in Western countries. So Western research will not be able to tell us these are buffers. We are trying to understand the buffers also for the child, even if the mother has been depressed in the prenatal and postnatal period. We look at maternal sensitivity. So sensitive mothering is a very important aspect of helping a baby learn to manage emotions. Like I said, the first 3 months of a baby's life are super important because that is the time the baby learns how to soothe itself, how to manage my emotions, how to feel secure. And if that doesn't happen, then later in life there is a problem. So the ability of a mother to understand an infant's emotional state, to rapidly respond to it, and to restore regulation and help the infant to manage emotions. It's a very important aspect of mothering which, can support the infant later in life also. These are some of the videos I'd like to show what we do. So we are actually doing the videos of the mother-child interaction. This is at 6 months that we are doing it. This is in the lab. So basically what we do is we tell the mother to bring the baby's favorite toy and we give a basket of toys. It's a 14-minute video. 7 minutes the mother plays with the baby's favorite toy and 7 minutes we give a standard toy set. We video it and then we code it. The video is 14 minutes, the coding takes 2 hours. Very trained raters are there. This is called the NICHD rating, where we rate the mother-infant interaction. How sensitive is the mother? Does she respond? Is she pushing her agenda into the baby's play, or is she following the baby's agenda? Is she understanding the baby? How is the baby responding to the mother? How much is the baby looking at the mother? What are the kind of verbal and non-verbal cues? So it gives us a good idea about maternal sensitivity, and we find that mothers who are depressed are obviously much more withdrawn. They are not actually active, and trying to use that as a variable to understand the importance of mothering for the baby. We take the saliva samples, like I said, and we also do very detailed neurocognitive assessments. This is one of the studies which we published, which looked at anxiety and depressive symptoms in pregnancy, and what we found was that the birth weight was differential in male and female infants, with maternal depression affecting male fetuses more than females. So male babies had lower birth weight compared to those mothers who were not depressed, but in females it didn't make much of a difference. I was talking to you about domestic violence during pregnancy and postnatal period. This is our cohort data. If you can see, it's not very low at all. So this is pregnancy and postpartum. Psychological violence almost 42%, postpartum 37%, physical violence in pregnancy 15.8%, and post-pregnancy around 16%. So women are facing, so imagine if a woman is facing violence, what kind of stress she is going through in her pregnancy and what impact it's going to have on the fetus. This is my PhD student who's just got a PhD on this topic. This is my collaborators, where we looked at any domestic violence and its relationship to child emotional problems, and what we found was that any DV was significantly related to child emotional problems, and it was mediated through postnatal depression. Even when we controlled for prenatal stress, this fact remained. So domestic violence related directly to child's emotional and behavioral problems in pregnancy and in the immediate postpartum period. It's similar, that was emotional problems, this is behavior problems. We have just published this study. This is my other PhD student, Kavya, who's just again submitted her thesis, where she looked at biomarkers. And what she did was she had 157 paired mother-child samples. We had maternal blood samples where we looked at offspring saliva. We looked at inflammatory pathway genes and stress regulatory genes. So what we found, if you look at this graph to just summarize it, that maternal IL-6 had a significant negative correlation with IL-17A, and these are all emotionally regulatory genes. So maternal cytokines had an impact on the infant cytokines. If you see this, again, it shows maternal IL-6 and DNA methylation at 2 years. Again, maternal cytokines and stress has an effect of DNA methylation at 2 years, and similarly at 5 years. This is just to give you an idea that immune markers, a mother's mental health, how it can impact downstream effects, and the science is actually showing that this is what is happening through different pathways, through either immune pathways or through cortisol pathways. Alternate caregivers in a child's life in India, how will it influence outcome? We still don't know, because we have many, and like I said, this is my another student, Rupa, whose job is to work with grandmothers and fathers, and she videos them interaction with the baby, and she actually checks with the mother and grandfather, grandfather, how much time and what activities they are doing with this child, to see what is the level of shared caregiving that the mother is getting. So if a mother is going through stress, depression, what is the kind of support she is getting from any of these? Only half of our sample has alternate caregivers. Another half of mothers don't have any alternate caregivers. They are doing the work alone. So it will give us a good idea about comparison. Mothers with depression who have alternate caregivers, mothers with depression who do not have alternate caregivers. What is the impact going to be on this child? So this is just a flavor to give you an idea about the kind of research that is going on in this field, why maternal mental health is really very important, why as a community, as a society, we have to support mothers, because it's not just the mother's maternal brain, of course, is sensitive, but it's not just the mother. We are talking about the well-being of the fetus and the baby and the child and the generations to come through mechanisms which are very biological in nature and psychological in nature. So for all these reasons, I think this field is very, very important, needs much more research. So what we need for advancing research in this field is well-defined cohort studies with an interdisciplinary team. We need to understand different pathways which are both biological, psychological and social, and very good longitudinal research which require advanced analysis. So I heard that you're going to have a talk on AI soon. So machine learning for these kind of populations is very good, because there's a lot of data. There's biological data, there's video data, there's all kinds of measurements. And for this, the human brain sometimes can be very limiting. So using more advanced methods will give us a better idea. And these things are important because we need to know where should we intervene, at what time should we intervene, how much should we intervene. And these are all community samples. So this is what is happening in today's world in urban Bangalore. It's not research from some other country. It is research from our country, which is so important. So finally, if early adversity becomes biology, then prevention, care and policy must begin much earlier than we once imagined. And I would like to end with this. And these are my QR codes if people want to access any papers.
Let's stop.